how do we win patients back? Because it used to be pre-COVID, most patients, 95+% sign up for would take the MMR vaccine without question. And then now it's, ooh, I don't know if I trust this. I don't know if I trust that. For what you mentioned regarding autism, right? How scientific studies have rebutted it since. An argument that I've gotten from some of my more hesitant family members or family friends have been, oh, but the scientists are all paid off. They're all in on this. So how do we win the trust of patients back?
Wow, is that a tremendously difficult question that we're all going to have to answer moving forward? And I do think
Sorry.
that, oh my God, no, it's great. This is something that I'm retired. You guys are going to have to deal with it. No, 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 no.
Yeah.
I'll be continuing to work on this because it is tremendously important. And I think for a period of time, it might get difficult. And there's going to be a period where a lot of things in science, where we have clear scientific data, is going to come into question. It's already coming into question. And there are going to be folks pushing things that have no scientific validity, but sound really good, right? Wellness and supplements and a lot of things that are vague and that don't necessarily have any science behind it. I mean, come on, supplements? You can sell anything that you want in a supplement. I could put black pepper in a pill and sell it as a supplement and make any claims that I want because supplements don't have to go through the FDA. So if I want to get a prescription medication, it's gone through studies. Even the COVID vaccine went through studies. Okay. It got moved out rapidly because we didn't have a choice. We didn't have 5, 10 years to make the studies necessary on that. But there are a lot of things that are being promoted now that have no scientific basis behind them. And I don't mean to sound like a total Debbie Downer, but I think people are going to have to go through a period of realizing that those don't work before they get back to real science. The clinic I also started a long COVID center because we were seeing patients with COVID having, a number of years of symptoms following that. And unfortunately, like folks who, may have symptoms of chronic fatigue syndrome, which is similar to what a lot of patients with long COVID had, they were falling prey to these wellness centers that were popping up that were promising, you know, ozone treatments and stem cell therapies and hyperbaric oxygen that had no proof, that were not covered by insurance, and also diets and supplements and different things that patients just wanted to feel better. So they were going to listen to these statements that were being made by these wellness centers. Of course, you're desperate. You want to feel better, and regular medicine, we didn't have that magic pill. We didn't have the all-encompassing answer for them. So they're going to go to these centers and unfortunately spend a lot of money not covered by insurance to not feel better. So, hopefully, most people have not lost faith in our conventional medicine. Hopefully, we will all develop more faith in public health because we're going to need that for the next pandemic that occurs. And we need to rebuild that infrastructure. It's kind of more gone the way of private companies and private hospitals. But I do think there's going to be a period of time where people have to live through their own time periods of trying things that are not proven and not get the benefit from that and spend a lot of money before they come back to us and the conventional medicine.
Yeah, it is. So
How's that
basically,
for negativeness?
I mean, I think that it's perhaps a nicer way to put it is practicality. I think that people are, at the end of the day, and we're seeing this in electoral results, we're seeing this in the way people operate. People care about results. You see results and you say, okay, this works.
Yeah, I think like we say in my business, all politics is local. And I think that this conversation has to get more local again. I think that, when we look at the data, while most people might be hesitant to trust the healthcare system, most patients still trust their individual physician. And so, how do we make sure that it's their personal physician that's having these conversations with them? We're doing a lot of work with the American Academy of Pediatrics so that, especially with our youngest children who we know vaccines are so critical for, how do we have these conversations in a meaningful way where we can rebuild that trust with the patient and really, answer their questions and have an open dialogue? And I think bringing it back to that local trusted relationship is key, because there is so much incoming, as we all know, on the internet, and the misinformation spreads so quickly that it can be hard to point someone in the direction of a peer-reviewed study when they might not even appreciate what a peer-reviewed study is on a 30-second TikTok video. And so we know that the most important time that we have their audience is when they are in front of us as physicians. And so I think it is critically important that physicians take the time. And I know it can be hard and there's a lot of things to address in a short visit, but we have to rebuild that back into the conversation with the patient directly.